Raise your hand if you're a business owner. Raise your hand if you're a homeowner. Raise your hand if you make over $150,000 a year. Raise your hand if you can't afford medical insurance. Also me. Thank you very much. My medical insurance just went from $400 a month to $1,512. And now, guess what? Me and my daughter are gonna go uninsured this year and just hope for the best. Roll the dice like other Americans, I guess. Am I special, or is this happening to other people too? Thank you, Congress, for not extending the subsidies. I guess I'm just gonna be happy I don't have housing insecurity. What the actual fuck is going on? I mean, I actually have to cancel. I don't have a cheaper plan I can go to. I was on the cheapest plan. What the hell is going on? It literally went from $397 to $1,512.
If you find yourself in a conversation with someone about ACA tax credits lapsing and the benefits of Medicare for All, I want you to remind them that as it stands now in the United States, one, it is cheaper to die than it is to live, and two, we are the only developed country without single payer healthcare, Medicare for all, right? Free universal healthcare for all people. And we pay twice over currently for our healthcare. And let me explain to you why. You pay taxes to the government. The government then uses your tax dollars, your money, to fund research and marketing for pharmaceutical companies to ensure that medicine can be made here in the United States, right? And then the government goes, yeah, but we're not going to just give that to you. You've already paid for it. Okay, stick with me. You've already paid for this. And the government goes, yeah, no, we're not just going to give that to you for free. Okay, we're going to make you pay a middleman to have access to the healthcare that your tax dollars have already funded. So if people are like, I only want to pay for myself, baby, you're paying for yourself twice over every time you need to receive healthcare in the United States. So when people die because they can't afford healthcare this year, just know they paid to die too.
This might be a little controversial, and it is not financial advice whatsoever, but I don't have health insurance. I haven't had health insurance in forever. I mean, I've been self-employed for 8-9 years already. I don't know if I'm right or wrong. I have never felt the need to pay for health insurance because I don't think I need it. I'm healthy, thank God. I don't have any prescribed medications. I don't have any chronic diseases. The only thing would be my glasses, and it still doesn't cover them all. I get my glasses every 2 years, and I pay around $600 for them versus $600 a month, and I still have to pay. I have had people tell me, what if I get into a car accident and I need a surgery that costs hundreds and thousands of dollars? And that would be worst case scenario, and my brain does not go to worst case scenario ever. Dentist visits, braces, doctor visits, procedures, all of that is always much cheaper without insurance. You always get a discount if you don't have insurance. So it's not as expensive as you think, because I know when you get a procedure done and you pay with your insurance, they tell you, well, the procedure would have been $3,000, but because you have insurance, it's $1,000. And that same procedure would have cost me $800 without insurance. And I am very well aware that it is a tax write-off, but I still $500, $600 I'm spending a month on something that I don't need.
Story time for another reason propaganda I am not falling for is that the US healthcare system is anything but a joke and a for-profit scam. Story involves my son, who is currently studying abroad in South Korea, and this story all happened, keep this in mind, throughout my night last night. So his day, my night. So I read this entire story when I woke up this morning, and it all happened within one day for him. I'm a registered nurse, and I advocate for patients in the insanity of the healthcare system that is the United States. I also work in home health. Follow me for home health and advocacy tips if you so wish. Okay, now to the story. My son realized during one of his classes that his eyes have worsened significantly. He couldn't see whatever he couldn't see. And so that was the first text that I received, is like, Mom, my eyes are so bad. And again, this is like whatever o'clock in the morning for me, so I'm sleeping. And then progressively, he sends what's going on through text messages that I'm seeing the next morning. And it's that he went to get his eyes checked. And then pictures of him getting his eyes checked. And then the final picture was him wearing the glasses. And like, okay, I can see now. So you're telling me my 20-year-old son found an optometrist, went in immediately, got an appointment, got his eyes checked, not only got a prescription, was told to come back within 2 hours and had his glasses. So before I even woke up the next morning, I had the final update. Not only that, he paid $70. And that was because he didn't have yet the student insurance that he's going to have, which is like $40 a month. That's going to cover his health care while he's there. It's one thing to know how corrupt and ridiculous the healthcare system in the United States is, but it's another thing to see and hear with, and it makes you wonder if your 20-year-old here in the United States decided that they needed to go get their eyes checked. Think about that process. Getting the appointment. Then you're finally there. All of the different things are going to be like, oh, that's not covered, that's not covered. And then when you get your prescription, you're having to choose, and then it's only going to cover, 20% of it. And then you're going to try, these glasses are more expensive, and then it's going to take 2 weeks for them to be mailed. No. While I was sleeping last night, my son was able to accomplish it all. It's absurd.
The U.S. healthcare system is broken. Do not allow you or your loved ones to be discharged from a hospital if it is not safe. You have the right to say this is not a safe discharge. Had a patient who, these are my lunchtime rants, had a patient who was sent to us by the hospital, just the clinicals. We did not realize that the patient was already discharged. Found out that the discharge happened at late last night. Like the patient got home at almost midnight, and the patient didn't even know that they were being discharged. The patient's daughter didn't know. The patient's 99. What we also didn't know is that because of 0 clinicals that we received about a Plerex catheter that had been placed. So we found out this morning because the daughter called saying, where are you? You're supposed to come and do all of these things. And it's like, we didn't even know you were discharged. We didn't even know your mom had a Plerex catheter placed. And the daughter had zero training in the hospital. So no ordering of supplies, none of that. And didn't even know that her mom was going to be discharged until 10 o'clock last night when they said, oh, by the way, EMS is coming and taking your mom home. Do not allow the hospital to discharge you or a loved one if it is not safe.
I just need to complain for 1 second about our godforsaken healthcare system. Okay, so about 3 weeks ago, almost 3 weeks ago, maybe a little more than 3 weeks ago, I overextended my right ankle, like the back, like the Achilles tendon area. My amazing kitty tripped me when I was going up the stairs to the basement or from the basement, and hello, there he is. Thank you, that amazing kitty. I overextended my ankle while I was trying to regain my balance. Since then, it has been increasingly painful, but I don't go to the doctor for myself because, for one, I don't have the time with the kids and work and everything else. It's hard for me to take time out of my day to do those things. But for two, even if I wanted to go to the doctor, I can't afford to. So I am making, in my professional career right now, I am making more than I ever have previously in the other jobs, which makes sense because I've been at this place for almost 9 years, and I have a role in management, and my salary it's decent, but I'm still, with having kids and a mortgage and the bills and all of that, I'm still very highly debating getting like a weekend job to help pay my bills. So I'm not rolling in dough by any means. But I do have health insurance through my place of employment. So I pay my insurance every paycheck. I have a pretty high deductible, so there's that. But when I had COVID back in January and I went to urgent care to get swabbed, after insurance, I paid over $500 out of my pocket for that COVID test. And like, I get it. I work in healthcare, animal healthcare, but healthcare nonetheless. So I get that there's a fee. You know, you go to the clinic and the technician does the swab, and then you have to pay for the doctor's time, and then you have to pay for the lab charges, and the clinic then has to pay the lab for them to run the tests, and they have to recoup those costs. Like, I get how all of that works, but I can't afford, as a 38-year-old woman, I can't afford to go to the doctor to have my ankle looked at because they're going to want to take an x-ray. They're going to want to do all of the things. And I simply just can't afford it. I can't afford to have it looked at. And don't come at me. I know you're going to come in the comments and say the more I walk on it and the more I do all the activities on it, I'm just going to make it worse. I know all of that. And I'm not going to be able to afford to get it fixed at that point either. This is more for me to vent and kind of bitch and moan at the godforsaken state that our shitty country is in when it comes to, you know, their citizens and healthcare and all of the things. Like, it should not cost me $500 out of pocket for a COVID test when I have insurance. Like, I don't get it. I don't get it. And I need it looked at. It hurts. I'm still doing the things. Like, I went to my first workout class yesterday, and I was just like, kind of took it easy on that side. And so I'm not letting it like ruin my life, but it is increasingly painful. And I know that there's something wrong with it. And it just sucks because I can't physically afford to go to the doctor. Like, how are other people making this happen? Like, how do you prioritize your own healthcare? If what are you doing? What are you doing to afford to go to the doctor? Because I need those tips and tricks. Like, it's getting bad. It's getting bad. It makes like a crunchy noise when it's bad. So help me. What do you do? How are you affording to live right now?
It's a really funny experience to be an American and be used to our healthcare system here, or be brainwashed that socialized medicine doesn't work at all, and then go to another country and interact with their healthcare system. Because my first experience was when I went to Hong Kong, and I was having chronic strep at this point in time. I get sick. I walk into the nearest equivalent of urgent care. No appointment, no insurance. Wait like an hour, have my appointment, and afterwards the doctors were telling me, this is gonna be pretty expensive because you don't have insurance. And I was like, lay it on me. I'm ready. I knew this was gonna happen. The bill, medicine included, $150 US. And because I had chronic strep, I went there more than once. The first time I explained that I had chronic strep, and they told me, oh, just the next time you're having the start of symptoms, come in early so we can give you antibiotics early and you don't have to go through the whole shebang of getting sick. And every time I walked in there after that, they were immediately like, oh, we know you. Yeah, we'll give you your antibiotics and you can go on your way. I was so confused. Like, I don't even have to go through the whole, like, our little, like, gaslighting routine. You're not gonna gaslight me. I'm confused. And the third time I came in, they were like, yeah, this is a problem. Do you want us to book you for a tonsillectomy? Do you know how long it took me to be able to qualify for a tonsillectomy in the United States? I had to be chronically ill for 2 years, have like 8 documented cases of strep. Or when I went to Paris, I had to go to the ER for some reason and was telling the doctor, like, listen, I know I have no insurance. I know it's gonna be expensive. It's okay. I'm prepared for this. I'm ready for it. And the doctors looked at me so confused, like, don't you know this is a public hospital? It's free. Maybe just check with the front desk lady on the way out because you're not from Europe. And so I go to the front desk lady and she tells me, oh, just leave. I was baffled. I felt like I was scared to leave. I had to ask her like 3 times, are you I should just go. No credit card info, no insurance, nothing. I felt like I was robbing them, doing something illegal.
Ever wonder why the cost of healthcare is so damn expensive in the United States? Like how if you go to a hospital and you get a Band-Aid, it's $30. Let me show you why. Now this is actually my second pass at making this video because the last one I posted, well, you guys didn't really pick up what I was putting down. So let's explain it in a different way. To explain how hospitals set the prices for various medical procedures and services, I'm going to use this rather grotesque banana. And let's say that this banana represents a hospital service, such as an MRI, an X-ray, a doctor's visit, etc. So let's say you are the hospital and you're trying to figure out how much to sell this disgusting banana for, and you have a wide range of potential buyers. We'll call the first category of potential buyers the Lucille Bluths of the world. These are extremely bougie health insurance plans that will reimburse hospitals outrageous amounts of money for services.
I mean, it's one banana, Michael. What could it cost? $10?
Right, so in this analogy, they will pay $10 for a banana, even though this is clearly not worth $10. Hardly anybody has a Lucille Bluth level insurance. Now we're going to call the second category of buyers the Don Corleones of the world. These are the majority of health insurance plans, and they're not going to pay the absolutely absurd prices that Lucille Bluth is going to pay, because ultimately it would hurt their bottom line.
I'm going to make them an offer he can't refuse.
Rather, they negotiate with hospitals on a much lower and much more reasonable price for reimbursement for the same services. So for example, instead of paying $10 for this gross banana, they may pay $2 per banana. It's still more than the average person would ever want to pay for this, but a lot of people probably still could pay it if push comes to shove. Now the third category of buyers we'll call the Bernie Sanders of the world, and this would be Medicare and Medicaid. Good old Bernie wants to give healthcare to as many low-income working class families as they possibly can, but unfortunately Bernie doesn't have very deep pockets because the government has decided to invest its funds elsewhere.
I am once again asking for your financial support.
So Bernie can only pay 1 penny for this banana. So here's the conundrum for hospitals. They have to work with Bernie, but it's also really hard to continue producing bananas when you're only getting paid 1 penny for one of these bad boys. What they're getting from Don Corleone is probably enough, but not enough when you combine that with what they're getting from Bernie. And on top of that, Don Corleone is a mob boss who can't be trusted. So while these insurance companies have agreed to pay $2 for one of these bananas, they frequently renege on that process after the hospital has already given them the banana, which leaves the hospital in the lurch. Between the fact that Bernie Sanders is cash poor and Don Corleone is not a trustworthy person to work with, in order to have enough revenue to stay afloat and continue providing services, they have to take advantage of the fact that Lucille Bluth thinks that a banana is worth $10. Even though that's ridiculous, and everybody knows that's ridiculous. Which means it's in their best interest to sell this for $10 so that Lucille Bluth will actually pay $10. Now someone might say, well, why don't we just charge the Lucille Bluth $10 and everybody else a lower rate? And the reason why you can't do that is because it's illegal. You can't set multiple prices for the same service. So if you were going to set the price of this banana at $2, which is a little bit more reasonable, and then you would get the maximum amount of revenue from the majority of insurance policies, that would be the price that Lucille Bluth pays too. Even though she's willing to go up to $10, she's not going to cough up the extra $8 out of the goodness of her heart. So what the hospital decides to do is they decide to set the price of bananas at $10. Even though there's not very many Lucille Bluths out in the world, it's in their best interest to get as much money from them as they can whenever the opportunity arises. Now the Don Corleones of the world are still only paying $2 because they negotiated that price. And Bernie Sanders is also only paying 1 penny for this because Bernie Sanders negotiated this price. But the problem is that the person who's paying for these services in cash because they either don't have insurance or insurance denied their claim, well, they're stuck paying the absolutely ridiculous price of $10 per banana. Because, as I mentioned, it is illegal for the hospital to charge a different cash price. Some people in the comment section of my last video heard this explanation and said, oh, well, it's the hospitals and providers who are greedy because they're overcharging. It's not the insurance company's fault. No. Hospitals function with razor-thin margins. They have to do this to survive. It is the product of a broken system. Here's the actual scam. Hospitals and providers spend exorbitant amounts of time and resources in order to chase down Don Corleone because he's not paying what he promised. And on top of that, if somebody gets an insurance denial for a service that they've already received from a hospital, their next course of action is to apply for financial aid through the hospital. And in situations like this, it is not uncommon for a hospital to forgive part of, if not all of, that hospital bill. And so they are losing a lot of revenue that they should have received from the insurance company. In the state of Maine where I live, the largest hospital network in the state threatened to stop accepting Anthem, which is one of the big insurers in the area, because they were struggling with this so much that it was bankrupting them. The second part of the scam is that these insurance companies have these Lucille Bluth plans, even though very few people have them, so that hospitals have no choice but to set the cost of services higher. What this does is it makes it impossible for individuals to pay for medical services out of pocket, thereby making insurance necessary. Don't get me wrong, hospitals are not all innocent bystanders in this situation. There certainly are for-profit hospitals that do shady business practices too, but trying to pin escalating service costs on hospitals is absolutely not fair. This is just one of the many reasons why insurance companies are evil and are bankrupting this country.
The American healthcare system needs to get the fuck out of here, okay? This is crazy. I just asked for an itemized bill of earlier this month where I was dying and I needed to be hospitalized for 3 days. Bitch, the total of that 3-day service was $83,334.33. For what? For what? Oh my God. And I'm wondering if I get a degree with this service. Or walking down an aisle for surviving. You must be out your mind. This is the price of an Ivy League program. Not only was I dysfunctional during half of this stuff, I also didn't ask for half this stuff. Blood must cure cancer with how much they charge me for blood work. You gotta be $6,000. It sounds like I need to be reimbursed for all the stuff y'all took out of my body. Here's the fun part. $10,296. Do you know what that's for? That is for the HB room board semi-private med bed. What? Who the hell asked for that? I just need my airways open. Mind you, I got back problems. I really got back problems for 3 days in that bed. So make it make sense. Albuterol at home costs like $30. Apparently, in a hospital, it's like $462. I just needed help to open my airways. You would have thought I left with a baby. So moral of the story, it's better to ride it out and talk to Jesus. Because if it's your time to go, it's your time to go. If it's your time to stay, then he's going to make a way.
The U.S. healthcare system is insane. I just want to start this off by saying that I have really good insurance under my parents' names. And I had to go to the ER in November for a cluster headache that was on day 2 that would not cease after migraine medication, everything that I could take and think of. So I had to go to the ER to make the pain stop because I literally couldn't do anything without shooting pain. Anyways, for the one visit, $34,000. $28,000 is not covered. My mom goes, well, when you go to the ER, did you check that they were in network? And I said, it's the same building where I go to my other doctors. I figured it would be in network. She goes, no, Lindsay, sometimes if the ER doctors are not in network, you have to check for the individual doctors. I'm like, Mom, it's the ER. You think I don't check that before I go? I just